The inscription at Delphi reads, "Know thyself." Viktor Frankl took this seriously, but he took it in a direction that Freud, his most influential predecessor, would not have anticipated. For Freud, self-knowledge was excavation. The unconscious contained repressed material, drives, traumas, wishes, that had been pushed out of awareness because they were intolerable. Therapy was the project of bringing this material to consciousness, examining it, and integrating it. The model was archaeological: dig down, find what's buried, surface it. Frankl's model was different. He aligned himself more explicitly with Socrates, who believed that knowledge is not acquired from outside but recovered from within. Socrates did not lecture his interlocutors. He asked questions, carefully, relentlessly, without agenda, until the person arrived at a recognition they had possessed all along, without knowing it. The truth was always already there. The dialogue was the method of bringing it to awareness. Frankl applied this to values and meaning. His clinical observation was that most patients who felt without meaning did not actually lack values. They lacked awareness of the values they already held. The person who says, "I don't know what's important to me," almost always, under careful questioning, reveals a very clear sense of what they cannot bear, what they would sacrifice for, what they imagine their life would look like if it were going well. These are their values. They simply have not recognized them as such. The logotherapeutic Socratic dialogue is designed to surface this existing content, not to impose a value system, not to suggest what the patient should find meaningful, but to help them discover what they already find meaningful. Frankl was explicit that the therapist's role is not that of a sculptor who shapes the patient, but of a radiographer who makes visible a structure that was always there. This has a crucial clinical implication. It means that the person is not broken. The person who presents with existential emptiness is not, in Frankl's view, fundamentally lacking. They are failing to see what they already have. The therapeutic task is perceptual, not constructive. You do not build meaning for the patient. You clear the obstructions that prevent them from seeing the meaning already present in their life. One of the primary obstructions is hyperflexion, the excessive turning of attention inward that paradoxically prevents self-knowledge. The person who is constantly analyzing their own states, monitoring their emotions, trying to understand why they feel what they feel, this person is not moving toward self-knowledge. They are generating a kind of existential noise that drowns out the quieter signal of actual values and meaning. Frankl's dereflection technique addresses this directly. Redirect attention outward, toward the world, toward the task, toward the other person. Self-knowledge arrives, often, in the act of engaging with something beyond the self. There is a deeper point here about the nature of values. Frankl argued that values are not chosen, they are recognized. A person does not decide that honesty matters to them through a rational deliberation process. They discover that it matters through the experience of violating it and feeling the internal consequences. They discover it through witnessing it upheld in difficult circumstances and feeling something that can only be called admiration. Values are not constructs. They are phenomenological realities, things that announce their importance through the way they actually affect us. The Socratic dialogue in logotherapy is designed to help the patient attend to these announcements. What makes you angry? What makes you feel ashamed? What would you be willing to sacrifice for? What do you imagine you will most regret not having done? These are not therapeutic questions in the conventional sense. They are Socratic questions, attempts to trace the outline of a value structure that is already there, already shaping experience, and waiting to be recognized. Self-knowledge, in this framework, is not the destination. It is the beginning. Once the patient recognizes what they actually value, the next question immediately follows. What are you going to do about it? Subscribe to The Psychology of Viktor Frankl to explore more of his timeless ideas.